Before we begin, just remember, one simple mistake with resident information can turn into a serious violation. Let me ask you something. Have you ever talked about a resident outside of work, even casually? Or checked a chart just out of curiosity? These are the kinds of situations HIPAA raised the line to protect against. Hi everyone, welcome. Today we're going to go over HIPAA in a way that actually makes sense for your daily work as DSPs, CNAs, nurses, and administrators. In residential care, protecting private health information is part of protecting each resident's dignity, trust, and safety. In this training, you'll learn how to handle information the right way during everyday ARF and RCFE work. Residents and families trust your team with deeply personal information. When staff protect that information carefully, they reinforce respect, professionalism, and confidence in the care environment.
When privacy is ignored, the impact is real. Residents can feel exposed, facilities can face complaints and penalties, and staff can put both care and compliance at risk.
Protected health information, or PHI, is any information that can identify a resident and relates to their health, care, payment, or services. That includes names, diagnoses, medication details, room numbers when tied to care, and medical record numbers.
HIPAA applies to the people who work with that information. In residential care, that can include direct support staff, CNAs, nurses, administrators, and anyone handling resident records or care communications. Privacy means information is only shared for allowed reasons and with the right people. Security means records, devices, and systems are protected so unauthorized people can't get in. And this applies across every format you use at work. Spoken conversations, printed notes, charts, emails, texts, and computer records all need the same careful handling.
Start with private conversations. If you need to discuss a resident's condition, medications, or behavior, move to a private area and lower your voice so others cannot overhear.
Before you share information, verify who is asking and whether they are allowed to receive it. A familiar face or urgent tone is not enough. Check identity and authorization first. Use the minimum necessary standard. Share only the details needed to do the job, answer the question, or complete the task. More information is not better if it isn't required. Handle paper records carefully. Keep charts, MARs, and shift notes out of public view. Don't leave them at counters, and return them to their secure location when you're done.
Be just as careful with phones, texts, and emails. Use approved systems, avoid resident details in unsecured messages, and never send information to the wrong person out of convenience.
On shared computers, log in only under your own credentials, lock the screen when you step away, and log out when your task is complete. Convenience should never override privacy. At the nurse station, a compliant conversation stays low, brief, and limited to staff who need the information. A non-compliant one happens loudly where visitors, vendors, or other residents can hear.
When a family member asks for an update, don't assume you can answer. First, confirm the resident's permissions and your facility's process before sharing any health details. When you're in a shared room or common area, take a moment to notice who might be within earshot.
If the conversation involves sensitive care information, move it to a more private space away from other residents or visitors. Transport resident information securely at every step. Use sealed folders or envelopes, keep records out of public view, and never leave paperwork in a car, at the front desk, or in shared staff areas. If schedules or transport documents include resident details, store and handle them the same way you would any other protected information. Voicemails, screenshots, and photos are high-risk areas. Don't leave detailed medical information on voicemail, and never take or share resident images or screenshots unless policy and authorization clearly allow it.
And hallway talk still counts. A quick comment about a resident's behavior, diagnosis, or appointment can become an improper disclosure if someone nearby has no right to hear it. Residents have a right to privacy, respectful treatment, and appropriate confidentiality around their health information. Staff support those rights through everyday habits, not just formal policies. Residents may have the right to see or request that information through your facility's approved process. Your job is not to decide whether they should get it. Your job is to follow policy and route the request correctly.
Before you release any resident information, follow facility policy every time. If authorization is required, make sure it's signed, current, and complete before anything is shared. Don't assume a family member, friend, or caller can receive information just because they sound familiar or say the resident gave verbal permission. Verify what's allowed, use the proper process, and if you're unsure, pause and check before disclosing protected health information. Need to know access means you only look at the resident information required for your role and your shift responsibilities. A medtech may need the MAR and current medication orders. A nurse may need assessment details and care updates. An administrator may need records tied to operations, compliance, or an active issue. What you don't access is just as important. Curiosity is never a valid reason to open a chart, read a note, or ask a coworker for details that don't affect your work.
Verbal handoffs should protect privacy as carefully as written records do. Give shift report in a private area, not in hallways, dining spaces, or near visitors. Discuss medications, symptoms, and follow-up care, only with team members involved in the resident's care. Keep your voice low, stay focused on essential information, and avoid sharing more than the next caregiver needs to do the job safely. In ARF and RCFE settings, good care coordination includes good privacy practice.
Medication and treatment information must be handled discreetly at every step. During MedPass, avoid announcing medications, diagnoses, or treatment details where other residents or visitors can hear. Appointment information, new orders, and treatment plans should be discussed privately with the appropriate staff and documented in the correct record. Keep medication carts, paperwork, and screens positioned to reduce visibility. Professional discretion protects resident privacy and supports accurate care.
When outside providers, pharmacies, transport teams, or other partners request information, don't share it automatically. First, verify who's asking and confirm they're authorized.
Then check what's allowed under policy and share only the minimum needed, like a medication list for an appointment or limited care instructions for safe transport.
If the identity, purpose, or permission isn't clear, stop and escalate before releasing anything. Text messaging and mobile devices create real privacy risks in care settings. Personal phones should never be used to photograph residents or store resident details.
They also shouldn't be used to send screenshots of charts, messages, or medication information. Standard texting and unsecured apps aren't appropriate for protected health information unless your organization has approved them.
Even a quick update can become an improper disclosure if the device is lost, shared, or synced elsewhere. Use only approved systems for resident information. Professional boundaries apply on every platform, including personal accounts. If it involves a resident, it doesn't belong online. Casual visibility is still a privacy risk. Protect what others can see and hear, not just what you intend to share. Copies that are no longer needed must be destroyed through the approved disposal process. Small handling errors can create major privacy problems. Keep paperwork secured, avoid discussing details in public areas or vehicles, and hand documents directly to the right party. Privacy still applies from departure to arrival. Clear documentation protects the resident, supports the team, and reduces privacy risk. Privacy isn't only about records, it's also about how residents experience care moment by moment.
A photo in the facility, a story about a behavioral event, or a comment about an appointment can all reveal protected information through location, timing, or context. Sign-in sheets, whiteboards, printed schedules, loose papers, and open screens should never reveal more resident information than necessary. Front desks and common areas also aren't the place for detailed care conversations. Use a cover sheet when policy requires it, confirm the number or destination in advance, and retrieve printed records immediately so they aren't left on a shared machine or desk. The receiving provider may need current medications, relevant diagnoses, recent events, and contact information. A driver or transport team may need only what's necessary to support the resident during the trip. Document what was observed, what was reported, what actions were taken, and who was notified. Keep it factual, concise, and relevant to care, safety, or compliance. position charts, screens, and paperwork so others can't easily see them. Avoid exposing records in hallways, common areas, or anywhere they can be viewed by others. Social media is never the place to discuss residents or resident events. Even without names, details can still identify someone. Stay alert in reception areas, hallways, and other public-facing spaces. Visitors or vendors may be nearby, so protect information discreetly. Before faxing, printing, or copying records, double-check the destination. Then collect documents promptly so they aren't left exposed. During transport and transitions of care, share only the information needed for safe and effective support. Use a secure handoff and keep extra details private.
When documenting incidents and resident events, keep charting factual, objective, and relevant. Respecting resident dignity is part of HIPAA compliance, not separate from it. Knock before entering when appropriate, explain what you're doing, and speak to residents respectfully during care. HIPAA compliance is a workforce responsibility on every shift and in every role. It applies to direct care staff, med techs, nurses, administrators, supervisors, reception support, and anyone else who handles resident information. Each employee is responsible for following policy, using secure workflows, reporting concerns promptly, and completing required training. Privacy is not optional when things get busy. Consistent habits are what keep residents protected and organizations compliant.
Administrators and supervisors play a critical role in HIPAA compliance. They are responsible for enforcing policy, designing secure workflows, coaching staff when gaps appear, and making sure escalation paths are clear. When a privacy concern is raised, leaders should respond promptly, protect the resident, document the issue, and involve the right internal contacts without delay. Strong oversight helps turn policy into daily practice across the facility.
Routine moments can quickly become privacy issues if staff aren't careful. Let's look at a practical example from residential care. Before sharing anything, verify the person is authorized and share only what's appropriate. Never assume someone is authorized to receive resident information. Verify first. Share only what's needed for the situation. If you're not sure, follow facility policy instead of guessing. At the front desk, even routine questions need a privacy check before you answer. Verify who's asking. Confirm authorization and share only the minimum necessary. Texting resident details from a personal phone may feel faster, but it creates a privacy risk. Now let's recap the daily habits that protect privacy. In residential care, privacy is protected through careful daily choices. If something feels wrong, speak up immediately. Small shortcuts can quickly become privacy violations. That can be as simple as speaking where others can hear or leaving records visible. If you think a breach may have happened, protect the information and report it immediately according to procedure. Protecting privacy is protecting dignity. Let's all do our part to keep personal health information safe.